Yes, so this is part 2 on the series of TB in congregate settings. I do not have anything to disclose. So my objectives for this session, so hopefully participants will be able to list at least 3 preparation steps for a first-round TB screening in a congregate setting for an effective contact investigation, and also be able to identify materials and logistical considerations needed for a successful screening event to ensure complete data collection to inform your contact investigation moving forward. To do a short recap of part 1, Caitlin did a great job a few weeks back. Part 1 really focused on initial decisions, how to decide if you should test in a congregate setting. And then if you are to test, who is going to do the testing, when and where will it occur, what materials will you need, and who will need to be tested. And lastly, the importance of identifying a point person on both sides to coordinate things moving forward. And so this presentation, I have a little asterisk. So not all congregate setting investigations require an on-site screening for whatever reason. Sometimes there's a healthcare facility on site that people can get tested through. Sometimes people prefer to go through their own primary provider. But this presentation is geared towards deciding to test and then also going in and conducting the testing and the screening at the site. Okay, so first things first, who needs to do the screening? What staff needs to show up and actually do the testing? You obviously need someone to place the skin tests or draw the blood, but you might need more people depending on how many people you need to screen. What is the size of the space where you will be doing the screening? How much time are you going to be in the space? Do you have all day, or do you only have like a short amount of time that you can be in that space? And just really thinking about how long it takes to gather all the people you need to screen. How long does it take for them to fill out their paperwork, answer their questions about the paperwork, perform symptom checks, and collect the specimens on each contact. So thinking about how much time that's going to take and trying to get all hands on deck if necessary. So in the day or days before the screening, hopefully multiple days, but sometimes these things can happen pretty quickly. It's important to gather and assemble all of the necessary paperwork that you're gonna need. So administratively speaking, you need your consent forms, your notice of privacy practices, if applicable, the medical provider form, and I'll show these in a couple slides, being prepared for if people don't wanna be screened by you. It's a form that they can take to their doctor, and then their doctor faxes the results to us so we can get those results. Registration forms, the questionnaire, which I'll show in a couple slides, and I like to include a TB 101 information sheet. If you Google CDC TB elimination PDF, then you can get the sheet that I like to use. So I like to bring this because it gives people to kind of look at something and they can read over accurate information, and they can take it with them and just learn more about TB, because as we know, not a lot of people know a lot about it. And lastly, if minors are involved, so if you're working inside a school congregate setting, you will need to send out all of these forms in advance for their parent or guardian to sign permission. Sometimes it makes sense for people to get these forms in advance, especially if you only have a certain amount of time to be with them. In my experience, people usually don't bring them filled out and complete, but it's a nice idea in theory. So. This is the general registration form that King County uses. Some of these items we don't collect, so like income information, that's not really relevant, but what is the most important is the stuff in the green boxes. So people's first name, last name, date of birth, where they live, and also how to get a hold of them, their phone number. And then on the right, in the purple, this is the part that parents or guardians would fill out for their minors if you, again, are screening minors. This is the medical provider form that I mentioned earlier. If people don't want to be screened by public health, you can give them this form. They bring it to their provider. The provider tests them, screens them, and then they fax the results back to us. This is our TB questionnaire. This screens for symptoms of active TB and also screens for medical conditions and risk factors for progression. This is a packing list that my coworker, Mani Meraki, helped me put together. Mani's a disease and research intervention specialist, so she actually draws the blood and places the tests. So she helped me come up with this. On the left, you have screening and testing items. So these are actual items that you're testing people with. This is off the assumption that you're using QFTs and not skin tests, but you can adjust it accordingly depending on what you use. And then on the right are more administrative items. You have all your paperwork things to not forget, pens, very important, very easy to forget, flat surfaces to write on, clipboards, and then also depending on the space, you may actually need to bring things that you wouldn't think that you would need to bring. So you might need to bring your own tables, your own flat surfaces, chairs, privacy screens, disinfecting wipes. It just depends on the kind of space that you're working out of. And these are just some photos of packing supplies. On the top, you have loose supplies for a large screening event. And then on the bottom, depending on how many contacts that you have to screen and test, it might make sense to have ready-made draw kits so you can just grab and test and go, or you might need more supplies for a larger event. And last slide about before the screening, just a reminder to keep asking questions. Where will you be stationed at the site? Is there a private space? What's it gonna look like the day of? Keeping in mind confidentiality, especially, are there flat surfaces? Generally thinking through the logistics of the event, especially what's the plan for if someone needs urgent radiology, if they're symptomatic, what's the plan, who's gonna drive them? How are they going to get back? You know, all these logistical things that you want to make sure that you consider. So coming up with the plan, ironing out the plan, and communicating the plan with your site contact and also the staff that are going to be involved, thinking through all of the details. More detail is better than not enough, and it's very important that everyone is on the same page the day of. Day of the screening, you will meet with your site contact and set up shop in whatever space that you have. And be prepared to explain and educate why you are there and why certain people are being screened. And also being prepared to explain why other people aren't being screened if it's a situation where, you know, most people in the congregate site know about the exposure and they know, you know, I've been asked, well, why not me? Like, why am I not on the list to be screened? And so using simple language, I like to come up with a spiel beforehand to explain to them, and also encourage people who aren't on the list that you can always go to your doctor and get screened if you're concerned. A TB 101 session may be necessary depending on sort of what's going on at the site. As we know, there can be a lot of misinformation that goes on, a lot of erroneous Googling. So we want to nip that in the bud and do a TB 101 session and just be there for people to ask questions. This can take place either the day of or maybe a couple days beforehand, but that is a really nice thing to offer to people. And once everyone's screened and tested, communicating to people, making sure that they know how they're going to get their test results, what will happen if they have a positive test, making sure they understand the process of what's going to happen. And lastly, remind them of the second round of screening that will happen in 8 to 10 weeks, because most people think it's a one and done deal, but reminding them that we do need to most likely screen them in 8 to 10 weeks. At the end of the event, you want to double check lab requisitions, specimens, and ensure delivery to the lab if that is applicable. Collect information on people who need to be tested but who weren't there. Maybe they no-showed. Maybe if it's at a workplace site, they don't work there anymore. So just being sure that you have their names, their numbers, a way to get a hold of them and screen them. Packing up all your materials and making sure that you leave the space as you found it. Don't leave anything that says tuberculosis behind, because that could be problematic. And enter data as soon as possible. Especially if there are complex nodes that you need to enter and make sure that people are aware of. So in summary, there are many logistical items to figure out before our first round of screening takes place. You can never ask too many questions or go into too much detail. The first round of screening is definitely, it requires a lot of planning because this is sort of your chance to gather a good baseline amount of information that will be used to inform your contact investigation moving forward. And so the session that will happen in 2 weeks will focus on, okay, so what were our first round results? What were our second round results? How do you know if you should expand your circle? Looking at the concentric circle approach and things of that nature, kind of closing out that congregate setting contact investigation. So look forward to that. And